presentation. So just want to let folks know that we will be sending out a copy of the recording with the follow-up email. We'll also be sending out a PDF version of the presentation that our presenters are going over, as well as any resources that are mentioned. So if you hear about a really cool tool or a really cool resource during the presentation, please, and you don't see it in the follow-up email, I'm going to try my best to get to all of them, but definitely reach back out to me. We're kind of here to make sure that you're getting access to all of those resources. So if you haven't yet, go ahead and introduce yourself in the chat. Good morning, everybody. And we're going to give a few more seconds. Okay, we're going to end the poll. Okay, so it looks like pretty evenly across, but by smidgen, we've got mainly executive directors and CEOs, so welcome. We're thankful that you're investing time, your I know, stretched time into this important topic. So welcome, and welcome staff and administrative staff, both direct service and administrative. Doesn't look like we have any board members or volunteers. It's great though. A lot of the information that we'll be learning today, obviously you can make it available to your other team members. So with that being said, I am going to go ahead and pass it off to Dr. Terry Andrews, who's going to introduce our presenters for the day.
Good morning, everyone. I'm Terry Andrews. I am the administrator of Baptist Behavioral Health, and I have the pleasure to introduce two of our wonderful providers, Dr. Blanche Williams and Dr. Stephanie Schwartz. Dr. Williams, she's been a psychologist for 30 years and received her doctorate from Vanderbilt and has worked in many different agencies such as private practice, nonprofit, public, and federal. And what she does right now at Baptist Health is she specializes in helping patients who are diagnosed with cancer, as well as supporting their families during that difficult time at Baptist MD Anderson Cancer Center. In addition to providing direct service to her patients, background includes program development, management, organizational administration, teaching, as well as supervising interns and residents. She has a long history of treating trauma, substance abuse, and also working in the field of mind-body medicine, as well as the ongoing specialty of health psychology. So we welcome her. In addition, we have Dr. Stephanie Schwartz, who is also a licensed psychologist specializing in health psychology. And her training includes a doctorate from Finch University of Health Sciences, the Chicago Medical School. And she completed her postdoc fellowship at Mayo Clinic in Rochester, Minnesota. She has experience working with a variety of medical and psychiatric populations, including anxiety disorders, eating disorders, bariatric surgery, infertility, oncology, and hospice palliative care. In addition to patient care, she has a background in leadership, program development, and implementation, research, and in addition to Dr. Williams teaching students. So, you know, these two wonderful psychologists had approached us and, you know, at the Baptist Behavioral Health level and said, we want to get some information out in order to be able to support our providers, as we are seeing a lot of patients' appointments being overtaken by dealing with the symptoms that are presenting due to the current pandemic that we're in. And they did a wonderful presentation to our Baptist Behavioral Health providers, who include psychologists, neuropsychologists, nurse practitioners, psychiatrists, master's level therapists. And we wanted to take this opportunity to be able to share it with you. So with that, I want to go ahead and turn the floor over to Dr. Williams and Dr. Schwartz. And thank you all for joining us this morning.
Thank you, Dr. Andrews. And I guess we can take down the polling information so that just the slides are visible. We're really happy to be here and appreciate your turnout today. It's wonderful. Dr. Schwartz and I would like to take this opportunity to share some research and practical suggestions about coping with the COVID-19 pandemic. And so we'll start by talking about how humans deal with stress, how pandemic stress is different from other stress, and then how to build resilience and what resilience looks like. So first, I'm going to recommend that we all do the quickest and easiest technique for relaxing ourselves, moving a little bit out of stress. And that is to get as comfortable in your seat as you're able to, and to slowly take a deep breath, inhaling very slowly, holding for a second, and exhaling very slowly. Feels good, and it's great for the whole system, the body and the mind. And yes, it's true that this pandemic has stressed all of us in multiple ways. Even though the impact of the virus seems to have reached its peak, it's anticipated that there will be several phases ahead during which we will be required to continue to adapt and to continue to deal with more stressors that we may not even be able to predict completely at this point. Like all living things, humans are equipped biologically to cope with stress. When our brains recognize stress, they cause our bodies to adjust in lots of different ways that we're not even aware of. And one of the most important is the release of a big dose of cortisol, which is a hormone that's pumped out by the adrenal glands at the command of the brain. And cortisol is sort of a jack of all trades among the chemicals in our bodies. It's very important, playing a role in numerous vital functions, including metabolism, preventing inflammation, creating short-term memories, and also when we're in a fight or flight situation, an extra dose of cortisol really prepares our bodies and our brains to be in good form to fight or flee. This is what's called the stress response. It's evolutionary. So when that saber-toothed tiger comes into your backyard, cortisol is your friend. You want to be ready to fight or flee as necessary. It supercharges you. So this burst of cortisol positions a human being to handle stress by bringing about necessary chemical adjustments, and it focuses the brain on the immediate situation, puts it into a hyper alert mode. And as a bonus, a burst of cortisol provides needed exercise to our entire system so that it's even better prepared to cope in the future should another similar event arise. And this is like getting a vaccination, where an injection causes the immune system to be activated, and it prepares it for fighting some disease that might come about in the future. When we get a little shot of cortisol like this and are ready for fight or flight, then it's called inoculation. But when cortisol is pumped out like a sustained release drug, the inoculation effect begins to peter out. And the presence of high levels of cortisol over time begins to shortchange us. It actually starts to endanger our protective systems and damage them. So in many cases, a brief, moderate crisis that's effectively resolved, even if we don't like the way it's resolved, makes us stronger and better equipped to handle another crisis in the future. But what is a pandemic? It's certainly not brief, and it's not moderate. It's a long period of time during which we're on high alert. We're making lifestyle adjustments. We're coming face to face with the unknown. We're receiving constantly revised information about actual data, about predictions, about recommendations, about estimated outcomes, about when will the governor release his next phase, and what will he say, and will people follow what he says, etc. So what aspects of our lives are affected by a pandemic? The answer to that is you name it, and it probably can be affected. So in this scenario, our adrenal glands do their job over and over with little interruption because we're constantly trying to adapt to the new saber-toothed tiger, in a sense. And the adrenal glands administer cortisol as if it's by an IV drip. It's turned up pretty high. And in the case of cortisol, an IV drip is bad medicine. So let's look at just some of the ways a pandemic can stress us psychologically, producing prolonged and sometimes intense release of cortisol. We'll just go over this list quickly. We can fear that we'll get the virus. The structure we know in our ordinary lives might be disrupted. Our job situation might change a little or a lot. Our childcare, schooling of our children, parenting situations might change considerably, and we might experience too much togetherness at home. We might be somewhat concerned or seriously concerned about friends and loved ones outside of our home, according to their own particular situations. We're likely to be exposed to a flood of negative news, with similar issues being reported, whether you're listening to or reading about international news, national news, or local news. A pandemic is fraught with unknowns, and the situation is in constant flux. Social distancing can lead to feelings of confinement and isolation. We may not know how to fill our time under these circumstances, and this can lead to boredom or feeling at loose ends. We might feel frustrated or angry or scared when we know that some other people aren't following the guidelines that have been handed down to us, or maybe if they're mocking or protesting. And some people may feel frustrated or angry about the guidelines, feeling that they're too stringent. We might have concerns about personal or family expenses if our jobs have been affected. We might feel fearful about the economy in general and our personal financial future. So there are just so many ways, these and more, that our lives are affected by a pandemic. The emotions involved here are real, they're important, and they're stressful. And what does that mean in biochemical terms? Cortisol, cortisol, cortisol. There's the IV drip. So, as we said earlier, stress reactions are normal. We're built to have stress reactions. But especially when the stress is prolonged or intense, then we need to be aware of the toll it can take, because there are things we can do about it. So as the pandemic continues to unfold, we could notice physical, bodily reactions like, say, digestive problems, diarrhea, constipation, tense muscles, changes to our appetite, changes to our sleep, not being able to sleep well, or maybe feeling like we need to sleep too much, fatigue, blood pressure changes, breathing problems. The list could go on. That is in terms of how our bodies might respond to stress. Emotionally, we might notice excessive worry. We might notice heightened anxiety about things, low mood, easily crying, being irritable. Cognitively, that is how our brain is actually functioning in a practical way. We might experience poor concentration or an inability to focus for very long. Our thinking could be less clear. We might have more difficulty making decisions, or perhaps make decisions impulsively. We might notice problems with our memory. Behaviorally, we could observe ourselves having trouble getting along with other people, flying off the handle, using hurtful sarcasm, taking our own anger or frustration out on others, engaging in behaviors that we know are not good for us, too much drinking, smoking, using drugs, taking in too much sugar, eating for comfort rather than mostly nutrition, all kinds of habits like nail biting. And we might turn away from habits we've established that are actually good for us, like good attention to our diets and exercise. So if prolonged stress can affect us in so many ways, we want to look at how to increase our resilience or our ability to mitigate the effects of this much stress. We do that by approaching life from the perspective of wellness and adaptation. From this perspective, you essentially do three things. First, you make conscious observations of any changes in your functioning, physically, emotionally, cognitively, behaviorally, socially. You ask yourself regularly, am I showing signs that stress is affecting me negatively? And by consciously, I mean, we try to do it in an objective way. For your own well-being, you ask this question with real curiosity, not as if you're looking for trouble, but just being very open to finding out how is this stress affecting me? And then pat yourself on the back for recognizing any changes that might have come about. And then ask, what do I need that will help me to function at my best under these unusual circumstances? And maybe consider asking other people whom you trust for their input about what you might need. And finally, asking yourself, how could I fulfill those needs? And again, maybe asking other people for suggestions there too. So as a part of this, also look at who makes up your circle of support, your team. These might be the people you live with, the people you work with, people you communicate with regularly or even now and then. And then promote wellness and adaptation among the team. Now, how do we do that? Well, not by banging each other over the head about with wellness messages and advice, but by being honest first with yourself and then maybe with select others about how stress is affecting you. Listening to the members of your team, recognizing that each one of them is touched in different ways by this pandemic because each situation is different. Recognizing that each person's needs may be slightly different or very different. And that each person has their own unique strengths and contributions they can make and ways of caring for themselves that are very helpful to that person and can be helpful to the rest of the team as well. So be open to the different experiences of your team members, whoever your team is composed of. Trade ideas about resources, whether that might be finding a mental health provider who is available through telehealth services, finding things online that are appealing and could be helpful to you, like maybe a yoga class or an exercise video, a cooking video, whatever might contribute to your life. Use mindfulness apps and other apps that you think could be contributory as well. Downloading reading material from our wonderful library system and videos and music, as well as other places you can get those kinds of things. Get creative. Again, the attitude of curiosity, not only about what's going on inside of yourself, but what's going on inside of your team and what might be helpful to you and your team. Be curious and be creative. Set boundaries that are going to be helpful for you. When we talk about having a team, we don't want anyone to feel that that means that you should be into everybody's business and they should be into yours. There may be times when you have to set limits for people as they're trying to be helpful or as they're trying to lean on you. Consider establishing a buddy system for specific activities or goals, and be a model for good self-care. At this point, I'm going to turn it over to Dr. Schwartz, who is going to talk to us about some specific things we can do to cope with stress and build resilience. But first, we'd like for you to take another poll. So Isis, if you would launch the second poll, please.
Absolutely. So what you're going to see in front of you is a question that says, which one of the below is causing you the most stress? So again, this is just a single choice. So just the most stress. We know that folks may be experiencing stress from multiple ones, but just the one that's kind of gnawing at you the most. We'll give folks about a minute, and just a reminder that all of this information is anonymous. We can't see who's answering what. So we'll give folks another few seconds to answer, another 10 seconds. And I did just want to mention, if folks have any questions for Dr. Schwartz and Dr. Williams, to go ahead and put it in the chat. There is also a private chat function where you can privately chat the nonprofit center if you don't want to put your question into the general chat. And we're happy to ask that question anonymously for you. Okay, so a few more seconds, and we're going to go ahead and end the poll. Okay. So it looks like financial unemployment concerns is the biggest one, Dr. Williams and Dr. Schwartz. Okay.
Okay, yeah, thanks.
I'm going to stop sharing this and go.
Minimize. All right. So thank you. And now that Dr. Williams has talked to us about the way, stress can affect us, and especially in time of COVID, we want to learn more about, well, what can we do about that? And the purposes of that poll was, what we've learned is to not assume what someone's stressor is. Many of us in healthcare are assuming that someone's immediate stressor is getting COVID-19. But when we see that from that, it's more economic, financial stress. And what's interesting is we were actually, contacted by someone from the media, especially about that question, because they said that they're getting so many calls because of the unemployment rates and stress related to that. So this really represents, what we're hearing in general. So why is it important to identify what matters most? Well, first, I think it's really great that we have such a mix of people on, leaders, administrative staff, and direct staff. And so when I'm going through these strategies, think about ways you can apply them to yourselves, apply them to friends or family, apply them to your staff, or apply it when you're working with clients or patients. So, I'll talk more generally. So identify what matters most. So that can help you really focus your problem solving. We asked you what causes you the most stress on that questionnaire, that survey, but that doesn't mean that you're not experiencing stress in all those things. So identify what matters most, because otherwise it can become overwhelming. And we're going to talk, more about that, about how to deal and prevent that sense of overwhelm. So regular self-check-ins, those symptoms, emotional, behavioral, physical, that Dr. Williams talked about, checking in with yourself. When you're starting to experience those symptoms, and when you recognize that you are, ask yourself, well, what was on my mind, or what just occurred, before I started feeling that way? And also check in to see, are these things that are getting worse for me? So really checking in with yourself on those things. Self-compassion. So what that means is, it's not the same thing as self-esteem. What it means is, really having that compassion and understanding for yourself without putting judgment on during this stressful times. Basically, giving yourself a break. And think about, okay, how you would treat someone else in this situation. Maybe the things you're saying to yourself, ask yourself, okay, would I say this to someone else? Would I be this harsh to myself? And ask yourself that. And that then comes to reframing negative self-talk. So Dr. Williams had mentioned that maybe we're all stuck in the house. We have our, food, our snacks. We're all prone to right now, just like the freshman 15, maybe we're going to have a name for this, the COVID-10 or something like that. So if we, have a day where, okay, ate too many snacks, instead of saying like, God, you don't have any control yourself. Look at all the weight you've gained. Saying to yourself, you know what? Give myself a break. This is a limited time. Right now, if having an extra cookie or two is going to make me feel better, it's okay. So think about if you said that first thing to yourself versus the second thing to yourself. The things we say to ourselves really impact how we feel. So that's why it's important to recognize that self-talk and reframe it. So in the example of like finances or economic, if we say to ourselves, I'm never going to get out of this, I'm not going to recover, saying to yourself, okay, what's the likelihood of that? What's the worst case scenario? Worst case scenario may be like, I have to take some money out of my, 401. And we're going to talk also about other opportunities for control in general, but specifically related to finances and economics, since that's the big one that we've come up with. In this situation, recognizing common humanity, which means we're not alone. That doesn't minimize what you're going through, but at least I'm not alone in this. Am I likely the only one? As you can see from the poll, you're not the only one experiencing this stress. And what was interesting when I was watching Governor DeSantis last night, and I actually thought about it before he said it, I'm like, wow, his hair's getting thicker. He even said to himself, he's like, I haven't had a haircut since February. He just had a, new baby during all this, grandparents, no one has seen the baby. So, I mean, knowing no matter who you are, we're going through this together. So it helps normalize it. Focusing on the now. So this also gets back to negative self-talk. If we are focusing too much on the past and saying negative self-talk, such as I should have, or focusing too much on the future by saying things about what if, saying should have is going to cause us to feel depressed. Saying what if is going to cause us to experience anxiety. So focus on the now and the present. That's not to say we're not going to think about the future, especially when it comes to finances and things like that, but it's how much time and how you're saying it to yourself is what we need to be doing. And really staying in the present moment, mindfulness, and focusing on the here and now in a non-judgmental way. Opportunities for personal control is a huge one. Right now, there's so many things out of our control. So in the example of finances, saying to yourself, what's in my control? Okay, I've applied, maybe it doesn't apply to you, or maybe it applies to, your significant other in terms of they're unemployed. Okay, I can apply for unemployment. I know right now that, you know, companies are being more lenient. If I'm not able to pay a bill or need to defer something, I can apply for jobs. Seeing what is in your control, it empowers you, but also what we'll talk about is not letting that take over your day or your thoughts, and how to have balance. So seeing even the little things that you can have control over, and it could be something tiny. And this may sound silly, but for us, you know, women on the phone, and, you know, maybe men, those who were going to get our nails done and, you know, are haven't, and we're like, oh my God, this is a disaster. Just the littlest thing. Okay, you know what? I can do my nails. That's something I'm going to do, and I'm going to do that for myself. And it's empowering, and you're just getting, you know, some control. So you can see it can be from the littlest thing to the largest thing. So just identifying those opportunities, because right now it may feel like everything's out of your control. And, you know, for those of you, you know, we know that this is something we try to focus on with patients, clients also. Appreciate the positives. So as Dr. Williams, you know, said, it may be like, yeah, you know, I'm spending more time with my kids, but, you know, that could end up being a positive, negative down the line. But appreciate those positives. How often do you wish that, you know, if you're working from home, and I know not everyone on this call is working from home, but let's say you are, you know, working from home, you know, you spend more of that time. You spend more time with your pets, or you're able to do things at home or clean a closet like you're not able to. If you are still having to, you know, go to work because you're a frontline, you know, person, thinking about that sense of purpose and meaning really, you know, helps. Even if you're still in your mind having those reasonable fears, whether it's contracting the virus or in your mind thinking about finances, thinking about, you know, what did I do today? You know, how did I touch someone? I provided this one family or patient, you know, support. I helped them learn these strategies. Seeing what brings that sense of purpose or meaning. It could be, you know, you were talking to a friend today, and they were having a really tough time, and you helped provide them support and helped them be in a better place. So looking at that sense of purpose and meaning. Establishing goals. We all know, whether we're in this crisis or not, establishing realistic goals, you know, is key. So even if right now you're like, you know, I'm cooped up, or, you know, because of being out and about with work, I come home and I'm tired or I'm stressed, I haven't been exercising. We all know, even outside this situation, we don't set a goal of, I'm going to all of a sudden run a marathon this week. We set small goals of, I'm going to go for a 30-minute walk, you know, one time this week. And that then links to having a schedule or routine. I think for all of us, you know, whether we're used to living by our Outlook calendar, having some sort of schedule routine of, you know, appointments with clients or patients, that's kind of not happening as much right now. Or even if you still have your Outlook calendar, those meetings that you normally had, you know, aren't taking place. So rather than waking up to an unstructured day, I know personally for myself, I'm still creating my own Outlook calendar, including setting myself an alarm if, okay, today I can maybe go for, you know, a walk from 1 to 1:30. Instead of, you know, having my lunch, I can go for a walk, social distancing. But I set that as a reminder on my calendar to really have that schedule routine. And for some of us working from home, you know, I think we all got into the habit of maybe dressing casually, wearing our pajamas, not wearing makeup, which is a great break. But ask yourself, you know, would I feel better if I continued my morning routine? Not every day, but getting up, putting up makeup on, putting on professional clothes, because we also have to think about the transition that we're going to have to transition back to our normal life. So maybe work on transitioning that, you know, back to yourself. So you can get into that routine, but deciding what that routine is for you. And, you know, in finances, that's also, okay, I'm going to schedule from X time to work on making phone calls. Also, you know, that it's normal to experience anxiety or stress during this time. There's a normal level. And scheduling what I call worry time. So you're not spending the whole day worrying, and just say, okay, these 10 minutes, or, you know, with my spouse, you know, if we're worried about something, look, let's not spend our whole day talking about it. You know, let's, you know, just establish this, you know, time for it. this way too, if you're trying to do something relaxing, like go on a walk or, doing yoga, you're not, defeating the purpose by spending the whole time worrying and thinking about those things that cause you anxiety. Limiting your media consumption. So, again, and as Dr. Williams said as well, not spending your whole day, and doing it from reliable sources as well, and getting it from reliable sources. Connecting with others. And this is a big one, whether it's you're working from home or not. I have a friend who's an infectious disease doctor, and quite honestly, there's many people, he's like, do you want to go for a walk? And they're like, no, I don't want to go with you. So, there's misconceptions, but, of course, he's feeling very isolated. So finding other ways, to connect. We know virtually. I've personally, and this goes back to identifying a positive, I've personally found that for work, when we have Zoom meetings, when we see people's faces, I feel more connected than when I'm just hearing their voices. And that's been a positive for me, is because of additional projects we're working on related to this topic, versus, typically we have our, whole schedule of patients and we work in isolation often. I've gotten to know colleagues I probably wouldn't have got to know. So looking at those positives, okay, connecting with others. Identifying what are your coping skills. What have you used in the past to help you get through things? And remembering, okay, most of us have had something critical occur in our life that we had to get through and we came stronger from. Remembering those things that you can get through. And as Dr. Williams, mentioned, nurturing activities. And that's whatever works, for you. And the good thing about many of these is they don't cost anything. You can be taking a bath, you can be going for a walk, you can just be playing with your dog. Now we can, social distancing wise, also walk on the beach. So we can garden. There's many things, that we can be doing. And then, as well, and actually I wanted to get back to say one thing. I mean, another thing that we can do is setting a time when it comes to, the social aspect, and setting a time each day that, okay, we're going to call and we're going to talk to someone. The mayor has actually been talking about this from day one, where he's like, 7 o'clock, I'm making that phone call, I'm connecting. As a leader, and we'll talk in our next slide about leadership, he's setting that precedent and being a role model. Incorporating humor, that may seem like, well, how can I incorporate humor at this point in time where everything's so serious? Now's not the time to watch a depressing movie, so watch a funny movie. Also, when it comes to those negative self-talk, if you're someone who's never cooked before and now you're experimenting with cooking and something doesn't go well, rather than saying, to you and getting hard on yourself about it, saying to yourself, well, this is obviously why I don't cook. So trying to find some humor in it. And our basic needs. If we don't pay attention to those basic needs, which, for any of us that have an illness, taking our medications that we need to take, having sleep, eating, then our baseline is already not doing well. We know if we don't sleep or eat, we're irritable. So these are just some, and if we address these things, we can then risk leading to the next step of actual anxiety, depression, burnout. Let's see. Not advancing for some reason. Dr. Williams, do you have the ability to advance? Oh, there we go. Sorry, wasn't hitting hard enough. So leadership strategies, because we know we have leaders on the phone. As I talked about, avoid assumptions. We don't know what others are dealing with. We don't know what our staff are dealing with. So avoid having that assumption. Manage your own stress. Our employees know when we are coming across as anxious. They can hear it, they can feel it. And if they hear that from us, it's going to induce anxiety in them. So manage that. And the way you do that is being a role model for self-care. Take your oxygen first. Talking about, yep, I'm taking a break today, or taking that, one call when I'm going for my walk. And then staff know, okay, I shouldn't feel guilty if I am in the house all day and I take this break. If you're not in the house and you're working out in the field, as well, being that role model to know you found that time. Having those regular communications is really helpful. And this way rumors don't start and get dispelled, and they get dispelled. and they don't leave, it decreases anxiety. So when there's unknown or staff don't hear anything, they start to think the worst. And when you do share that information, sharing it with empathy and optimism, even though, you know, inside you may be like really anxious, worried, you want to come across as optimistic, positive. Now, in terms of managing stress, it's normal for us to experience stress, but express that to, you know, a colleague, to your, you know, family, versus coming across to staff. Being honest and transparent. Obviously, as leaders, there's certain things we can't share, but being as transparent as you can to keep people informed. And as Dr. Williams said, having an open forum for feedback, oftentimes our staff come up with the best ideas because they're on the front line. So getting their feedback, and that also helps them feel empowered. And really listening, not just to the different ideas, but, you know, and this may be easier if you're in a smaller company, but listening if you're hearing a change in someone. You're seeing that, God, they sound more down, or they sound more anxious, just to kind of pay attention to that, to maybe identify. And then lastly, providing those resources for support. And that's why I want to ask Isis to bring up our second polling question that speaks to that.
Definitely. So I will be launching the second poll. And you should see a question in front of you. Has your organization made any changes to support staff psychological well-being during this time? Just a yes or no question. So we will take a few seconds for folk to answer that. And Stephanie, you know, Allison made a great point in the chat about how these leadership strategies are also really great for case managers working with their clients.
Yeah, I'm really glad you said that, because there's so many applications. And I wanted to say too, because there's administrative staff on here, just even if you're not front lines, administrative staff are often front lines. They need to be the ones fielding the calls from clients or patients, making appointments, different things like that, and experiencing and dealing with the anxiety on the phone. So we all really are front line.
Absolutely.
Okay,
So,
that's good, 50-50.
Right.
Okay, all right. So next, and this is really good to know, because we've talked about, there's resources, like for example, at, you know, Baptist, for our staff, we're doing virtual support groups. We're, you know, promoting our EAP, different things like that. But it doesn't mean, based on your resources, it doesn't have to be something at that level. It could just be providing a site for resources. The different cities have very comprehensive site for mental health support, for practical support, but providing, you know, some level of support, you know, for psychological well-being. You know, even at the middle level is you expressing, you know, for people to, you know, come to you. So something to really think about, and hopefully after this presentation, thinking about ways you can implement support. Again, virtually, it makes things a lot easier. It could just be, if you have a small staff, giving a call, if you're a leader too, checking in with them. And, you know, just checking in, sending a kind of an email to them, supportive email, anything you can do. So think about that. Okay. And lastly, in addition to kind of group support, some stress and worry is normal, as we said, but really monitor if you already have a history of anxiety, depression, other things, making sure you're continuing virtually, you know, if you are seeing a therapist, making sure you're taking your medications, doing what you did before, and don't straying off that regimen. Monitor if you're starting to do things that are unhealthy, like drinking, like smoking. If you're seeing that your stress is getting worse versus staying the same, and particularly if it's interfering with your daily function. And sometimes we may notice these things in others before we notice it in ourselves. So really important to identify that. You know, and again, talked about another number of strategies, you know, for leaders, for everyone to apply this in every regard. And I want to emphasize again with leaders, something I just, you know, remembered, think about for us in terms of structure and feedback. Every day we know the president, the mayor, the governor is going to give an announcement. And think about how that makes us feel, that we know there's that structured communication, and thinking about it, you know, in the same way. So, you know, again, so I want to, unless Dr. Williams, you have anything else to add, I wanted to turn it over to questions.
Yes. So we did have a few coming in, but definitely, folks, please go ahead and continue to have those, send those in. So we did have a really great question come in around staff that are struggling financially. So, it's hard to bring up that conversation and talk to them when you really can't help. So really the question is, how do you help handle this indirect stress, and especially when its performance is declining because of it?
Right. Well, so I mean, several things. It's directing them, and again, this depends upon your company, what HR options there are. As I can just speak to like the city website for, I know Duval, and I'm sure others have it. There's many practical resources on them. So it's not that you have to have an immediate answer for them, but you can give them context or resources. You can normalize it for them. You can direct them to HR, help provide those resources for them, and provide that support. Dr. Williams, what would you like to add?
Yes, and I agree with all that. And in addition, recognize that there are times when resources and practical help are not what someone is looking for or needs, or they may need something else in addition to that. And what that is usually going to be simply listening without advice. That can be so helpful to people because there's such an emotional aspect to a problem like that. So letting a staff member know that you're here to listen, but setting boundaries on that, making a structure for it. Like, I can't listen to this all day, but perhaps we could check in a couple of times a week, and you can let me know how you're feeling. That might be useful.
And two, I mean, maybe sending out something more generally to all staff about, the resources available or those things, so no one feels like, God, this is directed just at me, or if someone's not comfortable coming to you about it.
Mm-hmm.
Absolutely. I did have an interesting question come in around, folks before this pandemic may not have had the culture of openness and sharing, being that vulnerable with each other. So kind of what would be your advice for leaders to build that trust with staff now, so that they are more comfortable being vulnerable and sharing those concerns and building that culture now after the fact when we're so isolated from each other?
There was a little research study done after one of the previous epidemics. I don't remember whether it was SARS or one of the others. And people working in organizations were asked what made it feel bad or not so bad at work. And the top answer was, we feel that we had input into how the organization was handling this crisis, this difficult situation. We were listened to, our ideas were taken seriously. So that's one place to start, because it's very business oriented, but it also lets your staff know that you're listening, you're open.
And to piggyback off that, there was another study that I saw that, one thing staff really felt was just knowing their leaders were available. Many people I've talked to have said, I have never interacted as much as I have now with my, leaders. And, just knowing that leadership is available, sometimes staff feel like, okay, I don't want to bother them, they have other things. But that was the biggest thing that came across, that reassurance that, your leader was available if you were comfortable and wanted to go to them.
And I think a way that a change can be opened up when it is an organization where that sort of openness has not been the way things worked is just to say to staff members, we're in a very different time now, and it's requiring some different methods. And this actually gives us an opportunity to get to know each other better. And so I want to have some little maybe listening sessions or exchanges of information to get to know you better and what your needs are, and also what your strengths are that you can bring to this very unusual circumstance.
And I think too, someone doesn't have to go to their leader, and it may be for them that's not the thing that's going to be most helpful. So I think by leaders just sharing the strategies, it may be the most helpful thing a leader can do is to help bring some of these other strategies to light for them that may really help them.
Absolutely. I did have an interesting comment come in about, you know, some organizations don't have an HR department, and so you have leadership really wearing many hats. And so I think any tips that you would have for folks that aren't, maybe this isn't a natural extension of their job before this and are now having to wear this hat?
I mean, for me, I would say, not to be like a broken record, is I think the good thing is having the resources out there, you know, and encourage you to go to the city website. You know, as an example, I went to the city of Jacksonville. I'm not trying to promote it, but there's so many resources, not just for mental health, but, you know, who to contact for this financial thing, if you need assistance with food, if you need assistance with childcare. So just even having that, if you can't answer the direct question, knowing where to direct them. Dr. Williams?
Yes, I think it's important not to feel that you have to have all the answers. If you're not an HR person, then you're not going to be an HR person. But you can still let your staff know that you will do what you can within your limitations to provide information and show them maybe a direction they might take, which might simply be going to a website.
And reach out to your other leadership colleagues as well. You're not expected on your own to know all the answers. So reach out to your other leadership colleagues for support.
Absolutely.
Hey, this is Terry Andrews. Can I also make a suggestion as a when you are wearing those many hats, you know, something that I think about, especially for the financial constraints for your team, is really focusing on the Maslow's hierarchy. So, you know, the first and foremost is the rent paid, is the light bill paid, you know, the necessities, and you know, really helping them with just the basics, because there are some things that they're going to have to make some hard choices to be able to forego payments on, like a credit card. And many of the loan forgiveness for student loans, not loan forgiveness, the student loan companies and the credit card companies, you know, it just takes a simple phone call right now to be able to tell them, hey, I need to defer payments, and no questions asked. I've had quite a few comments from different team members at Baptist say that it was no problem to do that. And then, you know, as Dr. Williams said, listening, that's very important, but all these that probably need to have some of your focus and attention on, and working on, you know, how do you cover those expenses. So that was a thought that I had as far as just what has to be paid each month and what can be foregone. Thank you.
Exactly. And it's also looking at what are the things you can like eliminate. You know, if you had a gym membership, making sure that they're not still charging you, you know, if it's on hold or you're not using it right now, seeing like what are your normal things that you can call and put on hold. Do you need the extra HBO channels? So looking at that as well.
Absolutely, thank you. And I know we have probably time for one more question, and I had a really interesting question come in from some of the staff, folks that maybe aren't in a direct leadership position, and thinking about how do they initiate some of these conversations, right? When maybe leadership isn't as invested in the process or doesn't have the capacity to do it right now. How do you kind of empower some of, if you want to call them support staff, to start leading these initiatives?
Well, one thing you could do is to share the video or notes from this presentation. If your leader's not interested in that, you could still say something like, you know, I went to this interesting webinar, and they were talking about the importance of communication, and I'd like to head up a little communication initiative, if that would be okay. Just being informal and helpful, and not going in with a sledgehammer, but just saying, I have something that might be helpful here.
Mm-hmm. And I think too, and I think that's, I mean, that's key, especially right now. I think most leaders would be open to, any support. But I think there's things that you can do as staff, that don't necessarily you need to go to a leadership for. Like, I've talked to someone where, they're used to maybe having lunch with colleagues or seeing them in the office. So they set up like a virtual lunch hour. So to still stay, connected. So seeing what other things that you can just do, amongst the staff.
Absolutely, thank you. And I did put something in the chat.
Even initiating things like a daily, a thought for the day that's sent out to everyone,
Absolutely. I think Dr. Williams might have frozen on us. So I do know that we're hitting our time. So I did just want to say thank you so much to Dr. Schwartz and Dr. Williams for your generosity with your time and your knowledge today. Dr. Schwartz, I know that you had a slide with your contact information. If you don't mind propping that up.
Yeah, I was just thinking about that. Sorry.
And as I was saying, I did put a link into the chat with this event survey, so please go ahead and fill that out. We want to make sure that we're providing content that is meeting your most pressing needs right now. And if you can't get that up on the screen, no worries. Oh, there it is.
I know, I was pressing every button, but I'm good.
So this is the contact information for Dr. Williams and Dr. Schwartz. Again, thank you so much for your time today. And folks, if you continue to have questions, we want to make sure that the nonprofit center is here as kind of a safe place for you to send those questions. If you want to ask them anonymously to Dr. Schwartz and Dr. Williams, you can continue to send those to me. I'm going to follow up with my contact information, so don't worry if you don't have that right now. But with that being said, Dr. Williams, anything you want to share before we log off for the day?
I think she may have froze, like you said. Well, I'm sure, I'll speak on her behalf. I'm sure she would feel the same. I mean, I just, I'm grateful for all you guys taking, the time for this hour, and just encourage you to, after this, even just write down one thing that you took away and can implement from it. And just, wish everyone the best. Dr. Andrews, is there anything that you wanted to add?
No, I think even if we could do future forums for the group or anything, that would be helpful. Any ideas or ways that we can continue to connect with the group to provide support, we're happy to do such.
Wonderful, thank you so much. With that being said, everyone have a wonderful day, and hang on. Keep hanging on. All right, thank you.
All right, thanks everyone.